who joined us today. Thank you for joining us today. I do want to introduce the few people that we have here today. We'll talk for about 15-20 minutes, and then we'd love to hear your questions. I know that there were some questions that were sent ahead of time, so we also have those. If you do have any questions while we're talking, you can definitely use the chat to send us. And when we're done, we'd love to hear your voices again and hear some more questions if you have any. My name is Limor Schwartz. I'm the Director of Jewish Family Services. I've been with JFS and the Federation for almost 10 years now. I'm a clinical social worker, and I've seen JFS grow in a lot of different ways along with our community as well. And with me today are Abby Palmer. Abby is a master's level social worker. She's our senior services social worker at JFS and has been with us about 6 years, running our case management program for older adults. And then Barbara Kanan, who's a master's level drama therapist, has been with us since 2020. Lucky her, started around COVID time. And she is our associate director of clinical services. And along with seeing therapy clients, she also coordinates our Kesher program, which is a creative arts therapy for Holocaust survivors, which you will hear of more. So we're very excited that you are here with us today to learn a little bit about what JFS does, what we're currently seeing in our community, and how we're either already addressing or planning to address the different needs in our community. We are going to be very informal, but I do have a few lovely slides for y'all to see. Hold on one second. Always need to remember how to share a screen. Here we go. So welcome to our learning night. Before we really talk too deep about the things that we do, I want us to really kind of focus about what are the core things that we do? How do we know what it is that we want to provide to our community and how it all kind of fits together? So all of our services are really come down to 4 different core services. Starting with our clinical and social services, we provide therapy services to those needing emotional and mental health support. We provide case management and counseling services. Those are both for adults and older adults in the Jewish community. Our case management program, which you will hear about in a little bit from Abby, is for adults and older adults and has been around for about 5 years, 5 or over 6 years at JFS in Wake County. But we also now provide for about 2 years now a case management program in New Bern, North Carolina, as we're the closest JFS to the east. And then this year, we also started doing some support groups as we were seeing that people could obviously not come physically to us. We wanted to offer them some support and some connection to the community. So our clinical and social services are all provided by social workers and by therapists. And altogether, already this year, we already started about 300 people. About almost half of them are brand new to our services, have never been to therapy or case management, at least with JFS, which really shows you the big need that's in the community nowadays. Our second core is our assistance programs, and that is comprised from both our food assistance, which is our food pantry and our mitzvah meal program. Our food pantry, which is a pretty small closet that feeds a lot of people, is the only food pantry in Wake County that also offers a kosher section. So we're very proud of that we are able to offer both perishables and non-perishables to people all around the Jewish community, but also for people who require that specific food. And then alongside the food pantry, our mitzvah meal program offers kosher style catered meals that are delivered directly to people's homes by our volunteers. We have seen a huge increase in need for food in the past couple of years. Last year, we tripled the amount of food that we gave the previous year. And this year in 2021, when we're not even done with the year, we've already exceeded that and have given about 20,000 meals to about 160 people in our community. So it really just shows you how many people really need that assistance. Alongside with our food, we also provide emergency financial aid. That's really for people who are facing eviction, people that their utilities are about to be shut off, or medical needs. So we really try to help our clients to avoid that emergency, avoid leaving their home, but at the same time work with them with our case managers to make sure that we address additional needs and make sure that no other emergencies come as quickly as that. And for those of you with students, we also are the local admins for the Jewish Educational Loan Fund. So that's a program that provides interest-free loans for students in the Jewish community that attend either undergrad or grad school as well. Our third core service is our outreach and community programs. And that includes a lot of different kinds of initiatives that we can reach to people who don't come to us necessarily directly. Along with that is a Hanukkah gift drive, which is happening right now until the end, well, not the end, sorry, until the end of this week, I guess. This year, our Hanukkah gift drive is supporting 27 children in our community, alongside additional families that are being served with the Green Chair Project. So those are ways that the community can participate and really help out in additional ways. That includes also some outreach bags for holidays for older adults who are isolated. It includes Shabbat or holiday services at senior living communities. In fact, we have about 7 confirmed Hanukkah celebrations in senior living communities just this year. Those are all volunteer-led. And along with those, we do some community education. We choose different topics or issues that happening in our community that we want to address. So either it is a program like the Great Scavenger Hunt that we had a couple months ago, which discussed and really addressed food insecurity. Or on the other hand, programs like the Senior Resource Fair, which we hope that some of you attended a few weeks ago, that really wants to bring more and more resources to people in the community so we can connect them and get what they need. And lastly, hopefully some of you have already had a chance to volunteer in our program. We have plenty of volunteer opportunities. Our volunteers are really the lifeline of our organization. We cannot do everything that we do without them. And they really do touch a lot of aspects of our organization. They do friendly visits to older adults. They are the ones that are leading the Shabbat services or Hanukkah celebrations at senior living communities. They provide tech support for seniors who are trying to really figure out how to get on Zoom and do so much more. Just this year, we had about 300 and something volunteers. They gave about 2,000 hours of their time. And again, we're not even done with this year, but they helped us a whole lot. So we do a lot in a very small, in a small capacity that we have. I wanted to show you a little bit before we talk specifically about how we're doing those kind of things as to what we've already done this year. And beyond of what we've already done this year, it's really important to also talk about the different things that we're seeing moving forward. Specifically, we have really seen this year more and more people reaching out. Some of those people are people who have never reached out to a social service agency, and some people are people who have seen us but need more and more support nowadays. I think that everybody has probably heard or continue to hear about the mental health crisis. We see that all around the nation, and that does not skip our community. We have a lot more people reaching out for therapy services, needing assistance with and support with anxiety, with depression, with isolation. At the same time, we're seeing more older adults that are feeling disconnected from the community, that are feeling isolated, that have nowhere to go. So we help them with both navigating the different resources in the community, but also really physically getting them there. We provided about 1,100 subsidized rides already this year for older adults. And throughout the time that we have had our transportation program, have already given almost 7,000 rides to older adults. Those are for medical appointments, to going to community events, to going to go get groceries as well. In addition to that, like I said, we've already exceeded 20,000 meals this year, which really shows that food insecurity is a big deal in our community. And we really want to make sure that we are able to serve clients all around, make sure that people have healthy food on their plates. And lastly, we're also really getting increasingly concerned as our county and our city are growing tremendously. We're really concerned about financial emergencies for our community, unemployment, and then affordability of housing. We have many clients who are currently really struggling with paying their bills, with paying their rent, or being pushed out of their homes because of the increasing rents, or because of their own inability to pay the rent. And it is really important to us to figure out ways that we can address those. So we've done a lot this year. our year's not over yet. We've already exceeded a lot of what we do every year. Our social workers, our volunteer coordinator, our program manager are incredibly busy at what they do. And we really are only touching the iceberg in our community. We do a lot with very little. We like to call ourselves small but mighty, and we really believe that because we do a lot with a small amount that we have, but we want to be able to reach to more people and do a lot more. So I would like to turn now to, and I'm going to actually stop sharing so we can see everybody too, but I'd like to turn to both Abby and Barbara to share a little bit about the work that they do and the specific roles that they take with JFS, so you can learn a little bit more about the people that we serve and the work that gets done with us. So Abby, how about you start?
There we go. I'm Abby Palmer. I'm a social worker working with the older adults in the Jewish community. And I've been with JFS for about 6.5 years, something like that. So our Senior Connections program started several years ago when Limor and the JFS team recognized that the needs of older adults required a social worker to work specifically with this population. And fortunately had the foresight to seek out funding, which we received. And that's when I came to the community and started this program for older adults. So what do? We offer social work services, which includes case management and counseling to older adults and their families in the Jewish community here in our area. During the pandemic, besides case management and counseling, we expanded it to doing groups. I did the Staying Connected group. I think I did that 3 different times with, meaning 3 sessions. How would you describe it? More like I think it was 6 sessions per group, and they continued to want more. And it was an important way to connect older adults who were feeling very isolated. We focused on supporting each other and working on coping strategies. We've always done programs to the community to help educate people about the issues of aging, the issues that older adults are facing. And most recently, I did a program moving from the pandemic to the next normal. I think I will need to do that many times because it keeps changing. So most of my clients are dealing with significant challenges, such as changes in their health, both physical and cognitive. I get calls from worried adult children, but most often I actually get calls from older adults themselves who are having difficulty managing in their current situation and don't even know what to do, where to begin, just knowing that things are tough. I'm now back to doing home visits. I prefer to do home visits because I can go into the home and really do a better assessment and determine what's going on, to understand the situation and the needs of the individuals. But during the pandemic, I will say my work did not in any way slow down. I had more clients than ever. While not ideal, I used Zoom, I used phone. It worked. We made it work. We did have a lot of clients, people reach out. I work with clients to consider their options, to understand resources, and to create a plan that meets their needs and allows them to live with dignity and to live safely. I do a lot of problem solving with clients and help them to understand what their options are. This is all a process. This does not happen quickly. It does not happen overnight. It happens over time. I help in navigating the healthcare system, the hospitals, the rehabs, home care, respite care, palliative care, hospice care. It's a difficult and complicated system, and most people need some guidance and advocacy to figure this out. Dealing with these issues is tough enough with family support and with adequate finances. But now take a moment to imagine if you're an older adult faced with problems and have no family support, or maybe very limited family support. And imagine being that older adult trying to live on an income of less than $1,500 a month. Or how about less than $800 a month? You can imagine one thing goes wrong and it turns into a disaster. I serve everyone in our community. It doesn't matter their income. But tonight, I want to focus on my work with the older adults in our community who are not only dealing with changes associated with aging, but struggling financially and are facing housing insecurity. Many people fall through the cracks of the income guidelines set by the North Carolina Department of Health and Human Services to access anything: Medicaid, special assistance Medicaid, food assistance, heating, cooling assistance, help with cost of medication, and other services. They don't qualify, and they don't have enough money to pay for these needed services. They're living month to month, often only paying enough on their electric bill to keep it from being shut off. You've heard of people not qualifying for some assistance programs because their income is only a few dollars off what the guidelines require. And many of these adults and older adults are in our community. We're not immune to this. There is a housing crisis not only in Wake County, but throughout the country. We see clients paying 7% of their income on rent, which leaves them for anything else that they need. They're faced with waiting lists of years for affordable or subsidized housing. And then they get on the list, they get a call about an apartment, they go through the application, and they are declined because they have poor credit. Why do they have poor credit? One thing out of financial resources, what we're talking about clients who lost their life savings during the financial crisis of 2008, or lost their life savings due to other crises in their life, whether it was suffering in a hurricane, losing their homes, or health care costs, or clients who have rapidly diminishing savings. I'm talking about clients who are struggling after a divorce that left them without anything financially. Clients who would like to work to help supplement their low Social Security income, but are facing ageism, which is all too real. Clients who are completely alone, no family, or estranged family, or clients who have family, but their family members are facing their own financial or health issues and unable to play an active role. Clients who are facing the role of caregiver for a spouse, or even in many cases for an adult child, and have limited resources, or if they have resources, they are worried, sick, that they will run out of money. Healthcare costs in this country are skyrocketing. It is no joke. As if it's not hard enough to be a caregiver for anyone at any age, but try at age 75, or maybe try at age 85. This is what I'm seeing. And clients who don't even access healthcare they need because they can't afford the copay on their Medicare Advantage plans. I could do a whole program about that, the insurance industry, and how that impacts older adults. So at JFS, I'm just going to give you some percentages. About 40% are falling below the federal poverty line or struggling financially. 10% are at risk of losing their housing. 50% are unemployed or living on fixed income. We are a microcosm of the general population of adults, and I'm going to talk about the adults 65 and over in the United States of America, okay? And just to give you an idea of what that looks like, 43% of single adults 65 and over depend on Social Security for 90% or more of their income. And I can tell you, Social Security income is not much. 1 in 3 older adults are living at or below 200% of the federal poverty level. And what does that mean? Well, for a single person, they're living on $25,760 a year. Older women are really suffering. They're more likely to live in poverty than men because of their time off of work, to raise children, to be caregivers, or because they had low-wage jobs. So it is challenging, the work that we are doing at JFS and the work, the clients that I'm seeing. I can't solve all the problems. I stand with our clients. I work with them day by day, year by year. I just saw a client today that I've been working with since I started, like over about 6 years. And we've been up and down through many different variations of what's happening in their lives and what they've been dealing with. A client today on an application for House Wake program, which is to help pay for her rent because she's already received a notice to vacate her apartment because of her inability to pay rent, because the work she was doing, her hours were cut during COVID, and she has never been able to catch up. So it's tough, but we're here and we do what we do and support people as best we can.
Thank you, Abby. And I think the work that Abby does with older adults is just incredibly complicated. It's most of the time not a one-time call. And like you said, there are some people that you work with for 6 years or so. The resources and services for older adults is just incredibly complicated. So it's been incredibly wonderful to have the case management program within JFS to really help a lot of people navigate those resources. Barbara, I'll let you talk next. Barbara's been seeing a lot of therapy clients with us and was coordinating our whole.
Yes, hi, thank you everyone. I'm Barbara Kanan. I'm the Associate Director of Clinical Services for JFS. And as Lee Moore shared with you all, I started my first staff meeting with JFS was basically the day that we had to shut down because of COVID. So yeah, I've been coordinating the Catcher program for the past year and a half. It's an amazing program for the Holocaust survivors here in Wake County. I run a creative arts therapy group for them each week. And then also in that first year, because of COVID, we created a caregiver support group as well that ran alongside of it to create a larger community of care around our survivors and individual connection between groups as well. So as you can imagine, there's a lot of isolation, a lot of complex trauma that has been triggered by COVID-19 and all of the socioeconomic and socio-political issues that we have felt and witnessed over this past year and a half. And in addition to the Kesher program, I now also have a caseload of individual clients that I see. And what I can say from what I've witnessed this past year is that it will come as no surprise to you and is emphasizing points you've already heard this evening in terms of a very profound uptick in anxiety and depression, a lot of complex trauma that is being triggered by this global pandemic. Currently, I'm seeing people ages around 10 years old all the way to in their 90s, and seeing anxiety and depression and a number of other issues across the board. Anxiety and depression does not discriminate on age. And so, if you think about, students and what they're going through in terms of just meeting appropriate developmental milestones is a challenge in and of itself, let alone navigating, having to foster new relationships, experience school, try to meet deadlines amidst COVID. And people that I'm seeing have been directly impacted from COVID as well as long COVID, well, indirectly impacted. So the impact is deep, it's wide. The other issues that we're seeing are an uptick of burnout. People are just very exhausted from everything that we all have had to navigate the past year and a half. Parental support for parents who are together, as well as co-parenting situations if family's been separated. There's a lot of layoffs, pay cuts, a lot of very real economic issues that people are dealing with. Single parents, there really is a lot that people are going through right now, as well as illness. So all of these things are difficult in and of themselves. But if we take COVID-19 and add it to the mix, it's been increasing the level of isolation, increasing a lack of community and everything that comes with community in terms of connection, in terms of a feeling of being seen and witnessed and validated in a person's experience and supported. So I think what's important to name as well is that we are seeing people in a hybrid approach. So there are some clients who prefer to be seen in person, and so I'm seeing them every week wearing masks in the office with our air filtration system. And then I'm seeing folks who prefer to be seen virtually. And in some ways that actually has been a benefit to some of the people that we serve in terms of their, in terms of their physical needs and level of convenience in terms of that experience. And then some people I'm seeing both in person and virtually as needed. So there's a lot of moving parts right now to how we're serving people in this mental health crisis. And I think what also is important for you all and for our community to know is that our caseload is full. Not only full, it's over full. We are at capacity. A few weeks ago, I had one day where I spoke to 3 new people and brought them onto my caseload in just one day. There are people that we had to turn away because we are at capacity right now. And that's really hard to do for people who are in need. And it is the reality because, as Limor said, we are mighty and we are also small. We are human. We only have the capacity to do so much right now. And so we, of course, refer out and provide referral sources, as well as the opportunity to be on a wait list, which we do have. We have people on our wait list right now. I think, as Abby said, the work during this pandemic, during this past year, has not slowed. It has really only increased. And the level of need that I've witnessed within our community has only increased as well and gotten more complex as well. It's a privilege to be able to serve our community. And I appreciate the opportunity to speak with you all tonight about the level of need within our community. And speaking of needs, we did recently put out to the community our community needs survey, because we feel very passionately about wanting to meet everyone's needs. And in order to do that, we need to communicate with you all. We need to hear from you all. What are the ongoing needs? What are the emergent needs? And that has been, I think, really helpful. We've already started to see some information come in from those surveys that we want to implement and put into action. And so, yeah, thank you for the opportunity to share with you all tonight.
Thank you. I think we're very fortunate to have really passionate staff and really passionate volunteers that really help us achieve our mission. And we would like to take that passion and continue on and help more people. And this is why this survey is so important to us as well. So if you haven't had a chance to fill our community needs survey, we would love if you do that. You can scan a barcode or you can just go directly to our website. It is open until December 1st. And we really hope that you will give us your input, whether you received our services before, considered it, or never needed to it as well, because what we really want to know is who are the people in our community, what are their needs, and how we can address them best. So all three of us, and plus the 5 other staff that's not represented on this call, could really talk about what we do for hours, because we really are passionate about. So this was us like saying on the tip of our tongue, like really what we do. So this was nothing, but we would love to hear your questions, because we can try our best to answer them. I know there are a few that came in a chat, and there's a few that were sent ahead. How would you like to do that, Mindy? Or Rachel? Jeremiah? Or do you want me just to read them? I can do that.
Why don't we go ahead and address the questions that were put in the chat box
Awesome.
during your talking, and then we can hit some of the questions that were submitted in advance and see if any more questions pop up along the way.
Sounds great. So I guess the first question that we had is, what's the difference between case management and therapy? Do you ladies want to take that?
Yeah, I want to say that I am focused on specific issues that come up in older adults' lives, and they're trying to navigate, what do I do? How do I manage this? What are my options? Okay. There is a lot of counseling that goes into my work as doing case management. Okay. So I'm looking at doing an assessment, what are their needs, but understanding their emotional state and what they want, what they see, but also the reality of their lives and how they're living. And then starting to look at what the options are and working perhaps towards a change, and a sustainable change, you know, that is going to really make a difference in their lives. So for me, I just wanted to say that there's a lot that goes into it, a lot of counseling. It's not just walking in and saying, well, here's what you can do, and here's what's available. No, it's a process over time to really understand that person, and for them to come to decisions that they feel comfortable with, and then, you know, get there to meet their needs.
Yeah, and I would say not the opposite, but like kind of complementary, I would say. I feel like therapy is, because I think what goes into therapy in terms of how I approach it is, first of all, there are very real socioeconomic and sociopolitical issues that impact our mental health. And I think that working with Abby as a social worker and in that case management piece of how to navigate these really complex systems, how to advocate for oneself or have an advocate for oneself in these systems is really important. And so I think that's kind of a complementary piece there. And then I think in addition to that piece, you know, what you hear Abby talking about is like fixing things. How can we fix something? How can we problem solve? And for the therapy piece, I feel like my job really isn't to fix. It's actually to sit and be with a person in their experience and help that person identify that they have that inner wisdom, they have that inner power to be the fixer of their own issues, mental health wise, emotionally, relationship wise, career wise, what their goals are. I see my role much more as a partner, kind of leading and following in that process. So from a trauma-informed perspective, from a person-centered perspective. So I feel like that's the difference for me, and then also like what complements each other so well.
And I want to make sure that we all also understand they're not necessarily separate sometimes. A lot of our clients receive therapy because they are dealing with a mental health issue or a life transition, but they may also receive case management services because they're underemployed, because they need to find safe housing, because they're dealing with food insecurity. So a lot of times they do go hand in hand, and they can't necessarily be separated as well. All right. Our next question was, if we had more funds, where would you spend them? And that's obviously always the biggest question. I think, with the big needs that we have right now, the funds that we really need are for people. JFS is people. It's the providers that you're seeing here on this call. It's the social workers that are meeting face to face. And what we need are those people. We need more time for case managers for older adults. Barbara was talking about therapy for having 3 new intakes in one day. Abby, the other day I saw Abby at the office, but we never actually spoke because the phone continued ringing. But the fact is that we cannot be there for all. And we also don't want to turn people away, because there's reasons that people come to our organization rather than others. And we want to be able to support that. So the first thing that would go, it would go towards those people to increase the hours that we are able to provide for case management, for therapy, for support groups. Next, what Abby also mentioned is the housing emergency. And while Abby is very focused on older adults, we're really seeing it everywhere right now. We're seeing a lot of people that are really struggling right now with rent. And part of the solutions that we've been discussing is to creating some different kinds of solutions and initiatives for the people that we serve. We can't be the solution right now for affordable housing, because that's a way bigger crisis in our entire country right now, but we can support them. So it may mean for older adults to match older adults as partners to be able to create some affordable living arrangements. It may mean to help them with the credit checks. It may mean to help them with some moving costs and with the first month of rent, to be able to provide them with some respite. So some funds would go towards that. I could go on for hours, because we need some more facilities to be able to store more food for the increased need that we have for food. We need some more time to be able to develop our volunteer program. There's so much more, but really in the short term, the fact is that the mental health crisis is only increasing, that we have older adults who really need assistance navigating the different resources. And we need to be able to address in a certain way the housing emergency that we're seeing, and is only going to increase right now.
Right.
Okay.
I just wanted to add to that just briefly that because I truly think the system is broken. We need more affordable housing. We need more, but it's not happening, and it's not going to happen fast enough. Okay, so we do have to think out of the box and think creatively, and that's why we started thinking about shared housing, and that's happening actually throughout the country, but can we do it here in our community? And the answer is, yeah, we certainly can, and we can try, and we have been working on this. We have to really think differently about these problems, because we can't wait. People are suffering. We cannot wait for things to all of a sudden miraculously become available, because they won't.
Right. And at the same time, we also know our limitations, and we don't aspire to be the solution for everyone or everything. But we do have partnerships with different organizations in the community and outside the Jewish community that can help us. We can either support their work or they can support our own. So when it comes to affordable housing, all those organizations are overwhelmed. So everybody needs to find different kinds of solutions. When it comes to food, we work with the Food Bank of North Carolina to provide us with some more food. We work with Meals on Wheels to assist us as well with the funding for that. So we do a lot of work together to kind of go around sometimes. But the fact is that a lot of the way that we can create all these services really come from a lot of community support and grants to be able to support that as well.
I just want to emphasize to your point of partners being overwhelmed as well, just from the mental health perspective, that I know so many colleagues and so many practices that are offering mental health services that are also overwhelmed and completely at capacity. And so I think it is really important that whatever additional funding we are able to get, as Lee Moore said, it goes towards case management, towards people who are in mental health crisis, which those numbers are growing. So just want to emphasize that.
Right, and the other thing to think about is the increasing healthcare costs, and the population is aging. What's going to happen? I mean, this is going to happen quickly. older adults who can't afford home care, who can't afford to go to a facility even though they need it. This is the next crisis that is looming, and it's coming fast.
I see the mic put a question. Suppose someone wants to move to be closer to family. Do we have contacts for them? Abby, do you want to answer that? That's usually.
So wait a minute, Mike, I'm not sure. Are you talking about family moving to our community? I mean, someone moving to our community to be near family, or going to where their family lives? You got to unmute because we can do both. Let's put it that way.
Well, I'm the immediate case I'm thinking of was Evelyn, who lived here. She had a daughter here. And I guess her son is someplace else, and she has left the senior community she was in here and moved across the country to be there.
Yeah. Oh, yeah.
I don't know whether that was totally something.
I don't know. Yeah, I mean, I can't speak to
You
any
help with that, or was that something that was totally done?
I can't speak to any individual case. I can just say that we can connect with JFSs throughout the country. And I have, and they have connected with me too, with somebody moving from their community into our area. And we've coordinated things. I've also had, I work with Holocaust survivors and the Claims Conference for German Reparations and home care programs for Holocaust survivors. And when they move, I have to make that happen as well to get them what they need wherever it is that they are going.
The simple answer is that we never really turn people away. So if we can't do something ourselves here locally, we have contacts both locally and nationally that we can help them get set up, or that we'll always have some referrals and resources.
I just also want to mention, we also have people calling us because they can't afford to bury their spouse or someone who has died. And that's something that we have to jump on and deal with. And we have some contacts and we work hard to make it happen.
Absolutely.
You mentioned contacts nationally. Do you have international contacts too?
We are part of a network of Jewish family services that are not only national, but they're also in Canada and Israel and even Hawaii and Australia. So we have some international contacts as well. So we will find a way to help whoever needs to be helped. So I see the next question. Is there a success story that you can share with us? So Barbara, we really haven't mentioned Kesher yet. So I'm curious if you want to quickly share a success story about our Holocaust survivor creative arts group.
Yeah, I'd love to. This past year, the first year of Kesher, was just they're an incredible group. So we met once a week and completely over Zoom, particularly because we started meeting right at the height of the pandemic. And so this group went from, phone outreach, never having met anyone in person, to Zoom groups that ultimately took the shape of a film. They asked where their stories were going to go beyond this group. They wanted to reach the community. And so we created a film to do that. And I think even more important than this film are the relationships that have come from this group. We took a brief hiatus between the end of year one and the beginning of year two. If for anyone who has facilitated a group before, that the greatest success of a group is that they live on without you, the facilitator, being there. And that's exactly what this group did. They kept the exact same Zoom time each week throughout the summer between year one and ending and year two starting. And they themselves ran it and met each week without me there. And they also made plans. Some of them went out to dinner together. Some of them took a trip together over the summer. And, it was a real antidote to this isolation and incredible, some of them had just moved here right before the pandemic started. And so this really was their only group of friends for a while. And so the relationships, it's amazing what can happen via Zoom. The relationships that that took place and are still taking place have been just amazing to witness and wonderful, and every single one of them has come back for year two, and we joined with a school this year. We're with Carey Academy, so we are now an intergenerational program, which we always knew we wanted to do, and now this year we get to do it. And it's really, that has been an incredible success, and they're so resilient and amazing, and yeah, they're great.
We work really hard to empower people, to live their best lives, and we do it in a lot of different ways. So, all right, Mike Isaacs, thank you so much for the kind words. We love what we do, which is amazing. So your question is a little bit as a follow-up. Mike asked, how many additional people would you need to serve the clients who have contacted you and had to turn away? The quickest answer I can say is that we would need at least another part-time to full-time therapist and another full-time case manager that can really be able to take care of the need that we have. So we really don't want to turn people away, especially when it comes, well, actually for both situations, really, both with older adults and with therapy, there isn't really where to turn them to. Therapists are overwhelmed, and case managers for older adults cost a lot of money. So we really don't have where to turn them to, which is really why both Abby and Barbara are already seeing more clients than they really should in the first place for the time that they're paid for. But really a lot of it comes from passion. So I would say at least 2 other providers that we would need for that.
Yeah.
And
There's also more, if I can, sorry, I was just going to jump in really quickly just to name, just in case people don't know in terms of our time, and correct me if I'm wrong, but my understanding is that for JFS, Lee Moore is the only full-time employee. Every
Eight staff, and everybody but myself are part-time. So
right.
Somebody who works 5 hours a week to somebody who works 25.
So we're all part-time. Abby and I are part-time, trying to meet the need that's rolling in, which is an already over-demanding need. You know, so just wanted to name that so it was just really clear for everyone.
And Mike, you had a follow-up.
No, I just wanted to, so that's helpful. And that's just of who you already know about. That's not going out and recruiting or creating more programs or bringing, trying to get more people in. This is just to serve the people who have, who you are aware of and need.
Absolutely.
So that's pretty striking.
Absolutely. And this is part of the reason why our community needs survey is so important, because we also don't know who we don't know. But what we do know is that, like Abby said that earlier, and it's really true for all of our clients, the people that we serve are the same as the rest of the community. They don't have to be Jewish to deal with what they're dealing. They're the same way. About 11% of our entire clientele right now said that they're living under the poverty line. That's actually higher than the poverty rate for Wake County. So there's a lot of people that we're not reaching, and we're not reaching them because we can't, right? We can't actually reach out and find those people because we don't have the time to answer every phone call that comes in, even though we try. And also because they may not know what we do or how we can help them as well. So
I just wanted to add, what Limor and I discovered is that JFS is the only, as far as we understand it, the only nonprofit who is offering case management services for older adults on a sliding fee scale, $5. Some people can't pay that, and that's okay too. We will never turn anyone away. There's no, otherwise, if you're out in the general community and you're asking questions and don't know where to go, you have nowhere to turn if you have no funds. There are plenty of case management services for people who can afford over $100 or $50 an hour, or $700 for an assessment. And, but other than that, we're the only ones doing what we do. There should be more of it, believe me. I mean, it's daunting.
And the same goes to therapy, that we offer everything that we do on a sliding scale, which means that it's really based on your income level. And who we see are people that either don't have health insurance for therapy, so they can't even go somewhere else, because if you've tried going to get therapy and tried to do a private pay, then you will pay hundreds of dollars. So either people who don't have health insurance, or people whose copay will be more expensive even than coming to us. So it is really important to understand that the people, most of the people that we serve are not people that have means, and people that are not going to be able to get served somewhere else. The other piece of Mike's question was about grant writing. The Federation does have a grant writer, so she assists us with a lot of the grants that we write. We are about 45% grant funded, so a lot of the people that work at JFS are funded specifically by a grant. It's mostly with private foundations, but we do have some small amount of federal funding. But we are about 45% of that, so we do a lot of grant writing, so we can continue or expand our services.
But the needs keep growing.
Yes.
And so, and they will keep growing. And that's, it's a never ending, issue that we have to face as a community.
So if there's no other questions, I mean, we would love to answer more and more questions, but we also want to be respectful of everybody's time. I'm always available, and I love answering questions about JFS because I love what we do. You are welcome to email me at jfs@shalomraleigh.org or give me a call. I'm at 919-676-2295, extension 120. And I would love to answer your questions. And no matter what, I would love for you to spread the word about what we do, to fill up our community survey or spread that wide. And thank you for supporting our community, whatever capacity that may be.
Thank you.
Thank you all so much.
Thank you all so much for coming tonight. We have another learning night tomorrow evening, same time, same place, but different link. And tomorrow night we'll be discussing the important work that our Jewish Community Relations Council does for our community. Ladies, thank you again. It's a pleasure and a joy to work alongside you, supporting your efforts to do all of these amazing things and to keep growing. Thank you for attending tonight, and stay tuned. There will be more education opportunities, more opportunities to learn about what our organization as a whole does, how we do it, and how you can help us do even more of it. So thank you, and everyone have a beautiful evening.
Fantastic. Thank you so much.
Thank you.
Thanks.